Hey everybody, my name is Hannah Farmer and I'm going to be doing a business review as a pediatric acute/primary care nurse practitioner. So for my workplace setting, I would be an acute/primary care pediatric nurse practitioner who works primarily in an outpatient setting, working in contract for an acute care setting. So for the outpatient setting, I would be working at Blue Ridge Pediatrics, which is located in Boone, North Carolina, and we are open 6 days a week, closed on Sundays with a night and walk-in clinic. And for my acute setting, I would be working at UNC Health Appalachian, also located in Boone, North Carolina, and they are a 141-bed hospital with 4 pediatric intensive care beds. So a little background on Boone. We are a rural town in the Appalachian Mountains. We are located in the northwestern part of the state, about 45 minutes from Tennessee and about an hour from Virginia. I am local to this area, so I am very familiar with the population. And the population is 19,811. 1.4% of that are under 5 years old, and 5.7% are under the age of 18. As of 2023, the median household income was only $28,633, and our percentage of poverty was 52.1% of the population. So as you can see, that's very high. So my employment contract, what would I like to do? I would like to do 3 8-hour days, 8 a.m. to 4 p.m. at Blue Ridge Pediatrics, with one 12-hour day shift at UNC Health Appalachian PICU per week. I would have 2 on-call shifts per month that I would be able to choose, and the health, dental, and vision coverage would all be available immediately upon hire. My starting out salary would be $120,000. My malpractice insurance would be paid for by the employer, as well as my licensure fees and my CEUs, as well as tuition reimbursement would be available. For vacation and sick leave, I would like 5 weeks of paid vacation and 15 days of sick leave per year. A yearly cost of living raise and bonuses based on performance is also something that I would be looking for. So outpatient sources of funding, we have Medicaid, private insurance, and self-pay that's available at Blue Ridge Pediatrics. They do accept North Carolina and Tennessee Medicaid. They do see a lot of patients from Tennessee because we are only 45 minutes away from the Tennessee-North Carolina line. And Medicaid reimburses nurse practitioners 85% of the physician rate. They do accept private insurance. They accept Blue Cross Blue Shield, United Healthcare, PCHS, UMR, MedCost, TRICARE, and Cigna. These private insurances also reimburse 85%. And they do accept self-pay, but payment plans are to be available and must be agreed upon before the visit begins. UNC Health Appalachian accepts Medicaid, Medicare, private insurance, and they do have a self-pay program. So they accept the North Carolina and the Tennessee Medicaid. Medicare, which is typically for adults above the age of 67, but they can cover children with special needs after 2 years of Social Security. So they would have to be marked in severe functional limitations or be disabled for at least 12 months or expect to result in death. They can get Medicare sooner, however, if they have been diagnosed with end-stage renal disease or Lou Gehrig's disease, and Medicare also reimburses 85% of physician rate. They accept all private insurances, and they do offer a self-pay program, which is great for our location. They have a 25 to 100% discount based on the household income with 0% interest payment plan. This is great for our location because we are such a high poverty and low income level. It encourages patients to seek healthcare, which often they wouldn't due to finances, but with the discount, with self-pay, it encourages people to be seen. For outpatient payments, a new pediatric patient visit is a CPT code of 99203. The physician reimbursement rate is $60.58, so the APRN sees 85% of that, which is $51.49, and this is 30 minutes each visit for 4 visits a day. An established pediatric patient visit is a CPT code of 99213, and the physician reimbursement rate is $40.13, and the APRN, 85% of that amount is $34.11. This is a 20-minute visit, and I would see 15 visits a day. So the total reimbursement for new patients and established patients come out to $717.61 per day. For the inpatient payment, the initial inpatient pediatric critical care age of 2 to 5 years old is a CPT code of 99475. This includes the first full 24 hours after admission, and the physician reimbursement rate is $629.83. The APRN reimbursement rate is 85% of that, which is $535.36. For subsequent pediatric critical care visits, age 2 to 5, is a CPT code 99476, and this is every day thereafter the first 24 hours. The physician reimbursement rate is $313.11, and the APRN reimbursement rate of 85% of that amount is $266.14. So these include the initial assessment, stabilization, monitoring, treatment, and ongoing care of the patient. So here's an example of an inpatient payment. So billing for CPT code 99475 and 99476 for the first full 24 hours, reimbursement is $535.36, and each day thereafter is $266.14. So assuming 50% capacity, which is 2 out of our 4 beds, that is typical for Boone, North Carolina, or UNC Health Appalachian, because we are a smaller rural community. So we don't usually have high capacity unless we're in the winter months when everybody gets sick. And parents typically take their children, if they are really sick and need critical care, we'll take them off the mountain to our bigger cities and bigger hospitals like Winston-Salem or Charlotte. So let's say we have 1 new admission and 1 established patient. So 2 out of the 4 beds are occupied. That is $535.36 plus the $266.14, which comes out to $801.50. So estimated reimbursement per year, we take that 801 and we times it by 365 days in the year, and we get $292,547.50. So revenue to the facility, assuming that they have about a 5% bad debt, we're going to multiply that $292,000 by 0.95, and we get $277,920.13. So the total revenue, if you subtract my $120,000 salary and my $20,000 benefits, that's $140,000 a year the hospital is having to pay out to me. So if we subtract that $140,000 from the $277,000, we get almost $138,000 in net revenue. Of course, there is some wiggle room here as our capacity changes and our CPT code changes and things are added. But overall, you can see that the hospital is getting a great net revenue off of me, and the APRNs are an asset to facilities. So for a collaborative agreement, in North Carolina, nurse practitioners have to have a collaborative agreement with an MD or a DO, but we're not required to have our charts signed by them. However, the agreement must be signed by both the APRN and the MD or DO, and it has to be submitted to the board of nurse practitioners at least yearly. So outpatient collaboration with a pediatrician would be meeting with the pediatricians daily about my upcoming patient assignments, kind of reviewing what they are scheduled for, and consulting with the pediatrician about the complex patients and their questions. There's going to be sometimes when a patient comes in outpatient and their diagnosis or their symptoms are a little bit higher acuity. So this would be something that I would go and talk to a pediatrician about. For the inpatient facility, collaboration would be with a pediatric intensivist, and I would review patient cases, including their treatment plan, their diagnosis, and patient desires with them. I would do daily rounds with the physician during the appropriate times that we were both available and the patient was accepting. So this could even be over phone, video, or in person. So APRN scope of practice, we are able to diagnose and treat patients independently, prescribe medications and non-pharmacological treatments, order diagnostic and laboratory testing and interpret the results, coordinate care and counseling, and perform interventions. However, all has to be done while following hospital and facility protocol and policy. So the practice protocol, there would be instances where I would need to transfer care to an overseeing physician, and this would be necessary when the patient requires interventions or skills that are outside of the APRN scope of practice. So this could be surgery or even ventilation. The patient's diagnosis could also be too high acuity for the APRN to manage. So these include severe traumas, complex cardiac conditions, severe neurological disorders, end-stage organ disease, and there's also some cancers that the APRN cannot manage. So assessment and evaluation, I would appreciate a bi-monthly meeting and review with collaborating physicians. This is where they can give general recommendations or give me where I could improve in my care. Also, inpatient-wise, I would want to be looking at my rate of readmissions and my length of stays. For outpatient, I would want to see the recurrence of problem and visits. The reason why I would want to do this is so that I could see how effective my care was, how effective my education was. Did I educate the patient and family enough that they were able to manage their newly diagnosis outside of the hospital? Or are they having to come back in with increased rate of readmissions and an increased length of stay? Or outpatient-wise, are they having to come back and be seen continuously for the same problem? I would also want to do a patient satisfaction survey. This can be done inpatient and outpatient using a patient portal where patients can log in and do an anonymous survey. And manager can also go by inpatient and see the patients daily, make their daily rounds, and see how the care that I've been providing is. Is it safe? Are they satisfied? Is my bedside manner appropriate? And so on. I would also do anonymous coworker survey. I know this isn't typically done, but this is something that I would appreciate because I know how it can be working with providers. I want to make sure that the coworkers feel that they can come to me and that we have clear, open communication and that I'm a safe space. So we could do this with during staff meetings, inpatient and outpatient, and I can then therefore meet with managers to review the survey and review what my coworkers are saying and their recommendations. And these are my references. Thank you so much.